Hello, good morning, doctor and friends. Today we'll present our student project titled The Diagnosis of Dengue Hemorrhagic Fever Infection. And this is our student group discussion members. Okay, so we're entering chapter 1, Introduction. Before we continue, please allow me to firstly introduce myself. So my name is Skylenn Hertanto Tan with the last 3 digits of my student numbers 145, and today I bring about the introduction of our student project. So we discuss about dengue hemorrhagic fever, which represents a critical public health challenge where early diagnosis is vital to prevent severe complications. Yet clinicians often face difficulties choosing between the different diagnostic procedures. So the diagnostic dilemma is exemplified by our clinical scenario of a 15-year-old female presenting with a 3-day fever, requiring a precise decision to set the most appropriate confirmatory test. So to address this, our project conducts a systematic search and critical appraisal of current literature, applying evidence-based medicine principles to identify a diagnostic method that balances validity, statistical accuracy, and value-based medicine for optimal patient care. And that's all from me. Thank you.
Name is Wildan Mahsyar, the class student number 174. So about question formulation. This study aims to evaluate the diagnostic accuracy of commonly used laboratory tests for dengue. The research question falls under the domain of diagnosis, focusing on the sensitivity and specificity of NS1 ELISA, IgM ELISA, and RT-PCR. Using the PICO framework, the population includes patients suspected of acute dengue infection. The intervention are the index tests mentioned. The comparison relies on a Bayesian latent class model due to the absence of a perfect gold standard, and the outcome assessed is diagnostic accuracy at various times after symptom onset.
Hello doctors and friends, my name is Tirza Amaris with the last 3 digits of my student numbers are 060. I will continue the presentation with the title of the topic, Journal Search. For the student project, we conducted a literature search in PubMed using advanced search features to find articles on the diagnostic accuracy of acute dengue fever. We use a combination of keywords dengue or dengue virus and diagnosis or diagnosis accuracy or diagnostic test and RT-PCR or PCR and NS1 or NS1 antigen or NS1 ELISA and IgM or IgM ELISA and sensitivity or specificity or sensitivity or specificity. The search was limited to studies published in the last 10 years in English and of the systematic review or meta-analysis type. After reviewing the results, we selected one article that provided the most comprehensive and relevant insights for further evaluation. The selected article, titled Evaluating the Performance of Common Reference Laboratory Tests for Acute Dengue Diagnosis, a systematic review and meta-analysis of RT-PCR, NS1 ELISA, and IgM ELISA, was published in The Lancet Microbe in 2025. It was chosen for its large-scale analysis of 161 studies with over 120,000 participants, providing comprehensive data on sensitivity and specificity of RT-PCR, NS1 ELISA, and IgM ELISA. The use of Bayesian hierarchical latent class analysis enhances accuracy by accounting for imperfections in the diagnostic gold standard, making the findings more reliable. This article offers valuable insights into dengue diagnostic methods, making it highly relevant for critical analysis in this project. That's all about the presentation from me, and the presentation will be continued by my friend. Thank you.
So my name is Stephanus Rahardian with the name 139. So I'll continue with the critical appraisal. So does this study utilizes PICO analysis? So the short answer is yes, it does. And you can also see the details of the components here in this table on screen. So for the person, it's patients with symptomatic dengue fever. The intervention is NS1, IgG or IgM ELISA, RT-PCR or VNT. And there's no gold standard used as the control because the authors aim to compare the results of each test and see which provides the best results. And so the outcome is the accuracy of each test. So the sensitivity and specificity. Okay, so thank you.
Okay, let me introduce you myself. My name is Yanti Graciella with my last three student number is 162 and I will explain the next part. Based on the meta-analysis, it's highly unlikely that important studies were missed. The author conducted a very extensive and systematic journal search strategy in accordance with systematic review methodology. The meta-analysis provides several points supporting the systematic and extensive journal search. The author's statement that in the abstract that they search 9 literature databases minimize the risk of missing important studies. The use of these numerous databases reduces the risk of missing studies due to the size of index of the particular database. Furthermore, the abstract explained that the strict and clear inclusion criteria research used only primary data to focus on diagnostic studies. Studies that included relevant data and analyzes the data statistically can increase the precision of the result. Furthermore, the abstract also states that the meta-analysis was registered with Prospero. This indicates that the search method and strategy were planned before the studies was conducted. This is a strong indicator method of transparency, reducing the possibility of the authors intentionally or unintentionally omitting studies that do not align with their hypothesis.
Okay, thank you for the opportunity. My name is Valentino Wijaya with related to numbers 116, and I will explain about the inclusion criteria that used in this meta-analysis to select the articles and also the purpose. So in the first criteria, primary data with greater than 5 participants to avoid unreliable small samples, and then written in English, Spanish, French, and or Portuguese, ensure that the study can be understood and then published in a peer-reviewed journal to ensure scientific quality, and then report at least one diagnosis task versus a reference task to ensure relevance to the review question, and then both tests use the same serum sample to prevent sample-related bias, and then serology studies have to have initial part sample use that ensure that fair comparison, and then provide data for a 2x2 table or sensitivity or specificity to allow consistent accuracy of analysis. Thank you.
I will continue the presentation, but before that, let me introduce myself. My name is Tabitha Trinaindi Brusbiring with the last three digits of student number 232. So, in this section, we evaluate whether the studies included in the meta-analysis are sufficiently valid to address the primary question on the diagnostic accuracy of RT-PCR, NS1 ELISA, and IgM ELISA in acute dengue. The meta-analysis incorporates a very large dataset consisting of 161 articles and 282 2-by-2 comparisons. The quality of these studies was assessed using the QuADAS-2 tool, and the assessment was conducted in duplicate to reduce the risk of bias. Additionally, the analytical methods used, such as a Bayesian latent class model and hierarchical summary ROC, are appropriate in this situation where no perfect gold standard exists. However, there are several limitations. There is considerable heterogeneity among the studies, particularly in relation to days post-onset, difference in diagnostic kit brands, and variations in study population. Around 40% of the studies also did not provide complete reporting of the DO. Furthermore, almost half of the studies originate from Southeast Asia, which limits the generalizability of the findings to other regions. Some subgroups, such as RT-PCR in DPO 0 until 4, were represented by fewer studies, making those estimated less reliable. Therefore, while the dataset is robust enough to address the overall diagnostic question, the results should still be interpreted cautiously in clinical practice, particularly with respect to disease timing and population characteristics. That's all from me. Thank you.
My name is Ekaputra with the last digits of the number being 084. To answer the question, are the results similar from one study to another? The answer is not quite. The systematic review identified significant heterogeneity and inconsistent diagnostic accuracy across the included studies for NS1 ELISA, IgM, and RT-PCR, evidenced by the wide credible intervals that preclude the determination of a single universal accuracy value. This variation was primarily driven by inconsistencies in the timing of testing relative to the days post-onset, of the symptoms, as results only achieve similarity when analyzed within strict temporal subgroups. Furthermore, the lack of a consensus gold standard and the failure to distinguish between primary and secondary infections introduce an additional methodological and clinical confounding, significantly contributing to the lack of uniformity in the test practice.
Greetings, I am Theresa Paramita with the last two-digit number 131. So this systematic review and meta-analysis involved 161 articles and 245 diagnostic accuracy studies on dengue diagnosis. In the early phase of infection, within 0 to 4 days after the symptom onset, RT-PCR showed a very high sensitivity of 95% and specificity of 89%. NS1 ELISA demonstrated comparable performance with 90% sensitivity and 93% specificity, although the accuracy of both tests declined over time. On the other hand, IgM ELISA performed poorly during the early phase with only 17% sensitivity, but improved at the later days, reaching up to 82% sensitivity after 5 to 14 days. Overall, the findings suggest that IgM ELISA should not be used alone for early dengue diagnosis, while NS1 ELISA can serve as a reliable and more accessible alternative to RT-PCR, especially in settings with limited laboratory resources. These results support the broader use of NS1 testing to strengthen early detection and outbreak control efforts.
My name is Tjokorda with last digit number 189. I will explain about the clinical relevance. The first point is about the patient population match, which from the case, 49% of studies from Southeast Asia, mainly in India, and the inpatient and outpatient population, adults and children, and also have acute symptoms within 40 days, which is related to the case that have in Indonesia, and also about the hospital infrastructure compatibility. It's suitable for mid-level hospital labs and no need for complex equipment like RT-PCR. And then about the high diagnostic accuracy, NS1 ELISA have 90% sensitivity and 93% specificity, and so it's effective early detections, especially with IgM. About the global endorsement, they have CDC and WHO recommend NS1 and within 7 days. So the patient and method represent Indonesia settings and support evidence-based clinical decision. And that's all from me. Continue with my friends. Thank you.
Greetings, my name is Tracey Jiraldi Akemah with last digit NIM number 115, and I'll be talking about the integration of patient values and value-based medicine. First, we need to analyze test performance and cost. RT-PCR has an optimal time window from day 1 to 5, which is a gold standard for dengue confirmation with the sensitivity around 95%. However, they have slow results around 1 to 2 days and is expensive, around 495,000 to 950,000 rupiahs. For NS1, the optimal time window is from day 1 to 7 with sensitivity around 90%, and IgM has an optimal time window after day 5, around 82% sensitivity around 5 to 14 days post-onset. Both of them has fast results around minutes to hours and is cheaper, around 200,000 to 400,000 rupees. So the conclusion for value-based medicine, it depends on the situation. For initial screening, the cost-effective option is serology, like NS1 and IgM, due to lower cost and adequate accuracy for diagnosing. NS1 is used in the early days and IgM for later. For complex cases, RT-PCR is used in cases where the NS1 results come out negative, but clinical symptoms are severe, and if the patient could afford more expensive tests. That is all from me. Thank you.
Allow me to introduce myself. My name is Yohanes with the last three-digit number 089. In summary, the evidence from the selected systematic review shows that RT-PCR and NS1 ELISA are the most accurate diagnostic tests for early dengue infection, particularly within the first 0 to 4 days of symptoms. NS1 ELISA offers accuracy comparable to RT-PCR while being more affordable and accessible, making it suitable for use in resource-limited settings. IgM ELISA, however, has a very low sensitivity in the early phase and is better reserved for use after day 5. The critical appraisal confirms that the included studies were methodologically sound and clinically relevant to dengue endemic regions such as Indonesia. When combined with value-based medicine principles, NS1 ELISA emerges as the most practical and cost-effective first-line diagnostic choices, with RT-PCR reserved for cases requiring confirmatory testing. Overall, the findings emphasize the importance of selecting diagnostic tests based on disease timing, feasibility, and patients' need to ensure appropriate and effective dengue diagnosis.